So I thought I would talk briefly, or just have a conversation with you briefly today about the normal physiologic changes with aging that can make it hard for older drivers. There's a lot of misconceptions about what are normal changes with aging and what aren't. I think I might have told this joke when I was here the last time, but Bill, I hope you'll forgive me.
You know, I may not be able to remember.
There's a great joke that I think exemplifies the difference between normal and pathology. 82-year-old woman goes to her doctor and complains or tells him that her right knee hurts. So the physician examines her and puts her back in the chair and says, well, you know, at 82, what can you expect? Got arthritis in that knee. And she said, well, yeah, but my other knee is 82 years old and it doesn't hurt. So old age is not accompanied by pain as a normal feature of its of being old. And the two things that do change, though, normally, as people get older, that will affect your ability to be the driver that you were when you were younger, are cognitive processing speed. So as those of you who are over 50 or so in the audience know, it takes a little bit longer to remember things, have to pay a little bit more attention to store things, and it takes a little longer to get them out. And that cognitive processing speed, or the slowing of that cognitive processing speed means that when you are confronted with a perturbation in what's normal, something that's abnormal, it's going to take you a little bit longer to decide what you're going to do about it. So if you're driving down the street and a car suddenly pulls out in front of you, are you going to swerve? Are you going to brake? How quickly can you assess the surroundings that you're in to decide which of those two things is going to be the better maneuver, the safer maneuver? It's going to take you longer to do that than when you were 20 or 30 or 40 or 50. And that really does have an effect on your ability to drive safely. And we'll hear more about how that is formally assessed when Ann and Lissa talk about the DriveWise program. So that's one thing. And there's, unfortunately, all the crossword puzzles and all the new learning that you do can't overcome that normal change with aging. No matter how sharp you try to keep yourself, you're just going to be slower than you were when you were younger. And then the other thing that slows normally with aging, and Bill, I think you alluded to it, are reflexes. So Bill's grandson would be much quicker at straightening his knee and putting his foot on the brake than any of us here in this room. So your reflexes are slower, so it means that once you've done the cognitive processing to decide what it is you're going to do, your ability to then almost reflexively do it is slower. And those two things combined make driving harder as you get older when you come across things that are unexpected, or not. And then one last thing that affects people, and it's the first element of driving I think that adults notice as they get older, is how much harder it is to see well at night and drive safely at night. So one of the normal changes with aging is that your pupils don't dilate as widely as they used to. So it means that you can't see as well when it's dark, and that makes it harder to drive at night. So those are the three normal changes that you can't do anything about other than come up with strategies to be more attentive, to be more careful. One strategy that a lot of my patients use is, well, I don't drive on the highway, and I only drive locally to run errands, or I'm staying within a small distance of my home. That can be a useful strategy. It's not foolproof. As many of you probably know, most car accidents are within 5 miles of home. So to restrict your radius doesn't necessarily mean you're going to not get into an accident. So it's important to remember that you need to think about safe circumstances in which to drive, but just by virtue of staying close to home doesn't mean that you're going to avoid being in an accident.